All right, welcome to the deep dive. Today, we're going to be taking a close look at the Department of Health and Human Services, specifically all the recent restructuring and downsizing that's been happening over there.
Yeah.
You sent over a ton of really interesting stuff on this. We've got news reports from Fox News, CNN, the New York Times, and even what looks like some internal HHS documents, a briefing and a FAQ doc.
Yeah, it's a really good set of information to dive into.
Yeah, so we can really try to understand what's going on here.
Yeah.
And that's what we're here to do for you today.
Absolutely.
So today, we really want to cut through all the noise and figure out what's really happening, what's driving all this reorganization. What exactly are they changing at all these agencies?
Yeah.
And I think the most important question is, what does this mean for the people who work at HHS and also for all of us who are affected by their work?
Absolutely, because it's not just shuffling papers around, right?
Right.
It's about how it's going to affect all the services and safeguards that HHS is supposed to be providing.
Exactly.
Yeah.
So let's start with the big why.
Okay.
Why is HHS being restructured at all?
Well, the main thing seems to be this Department of Government Efficiency Workforce Optimization Initiative.
Okay, yeah.
From President Trump.
Right.
That's the big overall push to make the federal government, more streamlined. And HHS is a big part of that, obviously.
And at HHS, the guy in charge of this whole thing is Secretary Robert F. Kennedy Jr.
Right.
So what's he saying about why all this is happening?
Well, he's been talking a lot about reducing bureaucratic sprawl at HHS.
That makes sense.
He wants to kind of clean things up. And he also wants to shift the focus towards addressing the chronic disease epidemic.
Okay, so things like diabetes and heart disease.
Yeah, exactly. All those big health problems that affect so many people.
Right.
That seems to be where he wants to put the emphasis.
Okay, so tackling chronic disease is a big focus. But what does that actually mean, in terms of what HHS is going to be doing?
Well, they seem to be really into prevention.
How?
Making sure people have access to clean food and water, clean air, and trying to reduce exposure to toxins in the environment. And there's this quote from Secretary Kennedy that I think really gets at this. He said, "We aren't just reducing bureaucratic sprawl. We are realigning the organization with its core mission and our new priorities in reversing the chronic disease epidemic."
So it's not just about cutting back. It's about shifting priorities.
Exactly. It's about fundamentally changing what HHS is focused on.
And of course, we can't talk about this without talking about money.
Yeah.
Because a big part of this restructuring is about saving money, right?
Yeah, absolutely.
And how much are we talking about here?
Well, the estimate is about $1.8 billion per year in savings.
Wow, that's a lot of money.
Yeah, it's a huge amount.
And Secretary Kennedy has been pretty clear that he sees this as a good thing for everyone.
Yeah, he's calling it a win-win for taxpayers and for those that HHS serves.
So the idea is that by being more efficient, they can save money. And that will benefit both taxpayers and the people who rely on HHS services.
Right. That's the idea anyway.
Okay. So that's the why.
Yeah.
But what about the actual changes? How is HHS actually being restructured?
So there's a few big things happening.
Okay.
One is the creation of this new agency called the Administration for a Healthy America, or AHA.
AHA, okay.
Yeah.
So what is the AHA?
So basically, they're taking a bunch of different parts of HHS and merging them together.
Okay.
Like the Office of the Assistant Secretary for Health, SAMHSA, HRSA.
Okay, and remind me what those acronyms stand for again.
Right. So SAMHSA is the Substance Abuse and Mental Health Services Administration.
Okay.
And they focus on mental health and substance abuse services. And HRSA is the Health Resources and Services Administration.
Yeah.
They work on improving healthcare access for underserved populations.
Got it.
Then there's also ATSDR, which deals with hazardous substances.
Okay.
And NIOH, which does research on workplace safety and health.
Okay, so they're all being combined into this one new agency, the AHA.
Right. And the idea is to break down these artificial divisions between these different areas.
Yeah, I can see how that would make sense.
Yeah, and for example, bringing SAMHSA and HRSA together could mean that mental health and substance abuse services are better integrated with other healthcare services.
Yeah, that would be a good thing.
But then on the other hand, some people are worried that by merging all these agencies, the specific needs of each area might not get as much attention.
Yeah, that's a good point.
So it's like a trade-off.
Right. You gain some things, but maybe lose others.
Yeah, exactly.
So the AHA is one big change. What else is happening?
Well, they're also reducing the number of regional offices.
Okay.
Going from 10 down to 5.
Oh, wow. So cutting them in half.
Yeah, it's a pretty big reduction.
Yeah.
And they're also creating a new position, an assistant secretary for enforcement.
Okay. What's that all about?
So that person is going to be specifically focused on tackling fraud and abuse in federal health programs.
Oh, so making sure that money is being spent properly.
Yeah, that's the idea.
And what about the CDC?
Right, so the CDC is going to be absorbing ASPR.
Okay, and what's ASPR?
That's the Administration for Strategic Preparedness and Response.
Okay.
And they're the ones who are in charge of getting ready for and responding to public health emergencies.
Okay, so like pandemics and stuff.
Exactly, yeah.
So basically they're putting all the emergency preparedness stuff under the CDC.
Yeah, it seems like they want to streamline the response to health crises.
Makes sense.
Yeah.
Now, one thing that's been getting a lot of attention is the cancellation of all these research grants.
Right.
Especially all the ones focused on like gender ideology and DEI.
Yeah, over 500 grants totaling $350 million
Wow.
have been terminated.
That's a huge amount of money.
It is, and it's definitely a big shift in the administration's priorities.
So basically they're saying these topics are not a priority for funding anymore.
Yeah, it seems that way.
But it does make you wonder what kind of research won't get done now.
Right, because what about health disparities related to gender or other DEI issues?
Yeah, will those get less attention now?
It's definitely a concern.
And it seems like these cuts aren't just limited to research grants.
You're right. There's also been talk about consolidating HIV programs and cutting back on DEI initiatives across the whole department.
So it's a pretty consistent pattern.
Yeah, they're definitely focused on shrinking certain areas.
Okay, so we've talked about the why and the what. But now let's talk about the people.
Okay.
Because a lot of people are losing their jobs as part of this restructuring, right?
Yeah, a lot of people.
Well, how many are we talking about?
So the total workforce is being reduced from 82,000 down to 62,000.
Wow, that's a 20,000 person reduction.
Yeah, it's a shame.
And that includes 10,000 layoffs.
And another 10,000 people who are leaving voluntarily and not being replaced.
Right, so it's both layoffs and attrition.
And on top of that, they already let go of about 5,200 probationary employees earlier this year.
Yeah, so it's been happening in stages.
And from what I've read, it sounds like the way these layoffs were handled was pretty rough.
Yeah, there are reports of people getting layoff notices like super early in the morning.
Really?
Yeah, like before they even started work.
Wow.
And some people showed up to work only to find out that their building access had been revoked.
Oh my gosh, that's awful.
Yeah, it's pretty impersonal.
Yeah, it's just like cold and heartless.
Yeah, it really makes you think about the human cost of all this.
Okay, so let's look at some specific agencies.
Okay.
Starting with the FDA. They're losing a lot of people, right?
Yeah, they're looking at about 3,500 layoffs.
That's a huge chunk of their workforce.
It is, and it's affecting a lot of important areas.
Like what? Like the Office of New Drugs, the Office of Policy and International Engagement, the Office of Regulatory Programs.
So like all the key areas involved in approving new drugs and making sure they're safe.
Exactly.
And I read that even their press office is being put on administrative leave.
Yeah, the whole press office.
It's wild.
It is, and some of the former FDA leaders are really speaking out against all this.
Yeah, I saw that quote from Dr. Robert F.
Yeah, the former commissioner.
He said the FDA as we've known it is finished.
Yeah, he's not holding back.
No, he's really worried about what this means for the agency's ability to do its job.
Right, he's concerned about safety and about how long it's going to take to review new drugs.
And then there's the CDC.
Yeah.
They're also facing big cuts.
Right, they're expecting about 2,400 layoffs.
Wow, and what areas are being hit there?
Well, pretty much everything.
Like what?
Workplace safety, HIV prevention, injury prevention, reproductive health, smoking cessation, violence prevention.
So like all the core public health functions.
Yeah, pretty much.
And even the National Center for Chronic Disease and Health Promotion is being cut.
Yeah, which is kind of ironic given Secretary Kennedy's focus on chronic disease.
Right, like that's what he says he cares about.
Exactly.
And they're also cutting the FOIA office.
Yeah, the Freedom of Information Act office.
So it's going to be harder for people to get information from the CDC.
Potentially, yeah.
And the former CDC director, Dr. Mandy Cohen, she's also really worried about all this.
Yeah, she said these cuts are going to make the country less safe.
And less prepared for health threats.
Exactly.
Okay, so the FDA and the CDC are both losing a lot of people.
Uh-huh.
What about the NIH?
They're also facing cuts, but not as many as the other two.
Okay, so how many are we talking about?
They're expecting about 1,200 layoffs.
And where are those cuts happening?
Mostly in administrative functions, like procurement, HR, and communications.
So kind of like back office stuff?
Yeah, trying to streamline those operations.
And their FOIA office is also being cut.
Yeah, so similar to the CDC.
And there was this weird thing I read about senior leaders at the NIH being offered reassignments.
Yeah, like Dr. Jean Marazzo, the head of NIAI.
Right.
She was offered a job at a remote Indian Health Service location.
Really?
Yeah, and some people are saying that's basically a way to push her out.
Like make her quit rather than firing her?
Yeah, it's kind of like a forced resignation.
That's messed up.
Yeah, it's not a great look.
Okay, so the NIH is also being affected, but mostly in administrative areas.
Yeah, that's the main focus there.
Now, what about CMS?
Right, so CMS is also seeing some pretty big cuts, especially in areas related to equity and civil rights.
Really? Like what?
So reportedly, the entire Office of Equal Opportunity and Civil Rights has been eliminated.
Wow, the whole office.
Yeah.
Gone.
And what about the Office of Minority Health?
They're also, reportedly, mostly or entirely gone.
Wow.
And their website is down, which doesn't look good.
Yeah, that's not a good sign.
And there's been some strong reactions from people who used to work at CMS.
Like who? Well, Karen Shields, a former CMS executive, called it a disturbing dissolution.
Yeah.
And she also pointed out that the layoff notice sent to the Office of Equal Opportunity and Civil Rights included a really inappropriate referral.
What do you mean?
Well, she didn't say exactly what it was, but it sounds like it was something offensive or insensitive.
Yeah, that's not right.
And then there's Chiquita Brooks-LaShore, the former CMS administrator. She talked about how important the Office of Minority Health is for addressing health disparities.
Yeah, that makes sense.
So getting rid of it is a pretty big deal.
It sounds like it.
Yeah.
And it's not just the big agencies that are being affected.
Right.
There are also smaller programs that are being cut.
Like HEAP.
Right, the Low-Income Home Energy Assistance Program.
Yeah, the report is that their entire staff has been fired.
The entire staff?
Yeah, everyone.
So what happens to the program now?
Well, that's what people are worried about.
Yeah, how can they function without any staff?
Exactly, like who's going to administer the program and make sure the money gets to the people who need it?
And then there's the administration for children and families.
Uh-huh.
They're also being hit with layoffs.
Yeah. And one employee said they're worried that these cuts are going to make childcare less safe and less affordable.
Yeah, that's a big concern.
It is, because they provide a lot of essential services to families.
Right.
And then there's some really specific program cuts that are pretty alarming.
Like what?
Well, there's a report that they're eliminating a vaccine research program that was focused on preventing the next pandemic.
Oh, wow. That seems short-sighted.
Yeah, especially after everything we've been through with COVID.
Right, like we should be investing more in pandemic preparedness, not less.
Exactly.
And they're also cutting entire units that focus on reproductive health and gun violence prevention.
Yeah, those are two pretty big issues to just abandon like that.
It's definitely concerning.
Yeah.
Okay, so we've gone through the what.
Yeah.
Now let's talk about the so what. Like, what does all this mean?
Well, a lot of people are really worried about these changes.
Like who?
Well, we've already talked about Dr. Califf and Dr. Cohen.
Right.
They're both really concerned about the loss of expertise and institutional knowledge.
Yeah, it's like they're gutting these agencies.
Yeah. And when you lose all those experienced people,
Mm-hmm.
it can be really hard to get back that knowledge and those relationships.
And it's not just the big agencies like the FDA and the CDC.
Right.
There's also concern about the impact on all those essential services that people rely on.
Exactly, like LIHIP and the Administration for Children and Families.
Right.
Those cuts are going to affect real people in really tangible ways.
And the way those layoffs were handled, it's just so cold and impersonal.
Yeah, those early morning emails and revoked building access.
It's just awful.
It is, and there are even reports of problems with severance paperwork.
So adding insult to injury.
Yeah, it's a mess.
And Congress is also starting to get involved.
Yeah, Senator Bernie Sanders and a bunch of other senators sent a letter to Secretary Kennedy.
Really?
Yeah, they're really concerned about the lack of transparency around all this.
So they want more information about what's happening.
Yeah, they want to know how these changes are going to improve efficiency and outcomes.
And they're also questioning whether Secretary Kennedy is really being as transparent as he claims to be.
Yeah, they called him out as radical transparency promise.
Right.
And there's going to be a Senate hearing on all this soon.
Oh, really? When?
On April 10th.
So Secretary Kennedy is going to have to answer some tough questions.
Yeah, he's definitely going to be grilled by the senators.
And then there's that whole thing about the senior leaders at the NIH being reassigned.
Right.
Like Dr. Marazzo.
Yeah, it really seems like they're trying to force her out.
It's pretty shady.
Yeah, it's not a good look.
And then there are those stories about people confronting senators about being fired.
Yeah, and that senator who told a former HHS employee that they probably deserved it.
It's just a really chaotic and messy situation.
It is, and a lot of people are getting hurt.
Okay, so we've covered a ton of ground today.
We have.
So to sum up, HHS is going through a huge transformation.
Yeah, massive.
And it's all about saving money and focusing on chronic disease prevention.
Those are the big goals.
But it's also resulting in a lot of job losses.
Thousands of jobs.
And major changes to how these agencies work.
Yeah, it's a whole new HHS.
And a lot of people are really worried about what all this means.
Yeah, there are serious concerns about safety, preparedness, and access to essential services.
And it all feels really rushed and poorly planned.
Yeah, like they're just trying to make these huge changes as fast as possible.
So as all this plays out, I think the big question is, what's the future of public health in the U.S. going to look like?
Yeah, that's the million-dollar question.
Like, can HHS actually be more efficient and effective with fewer resources?
Right.
Or are we going to see a decline in the quality of our public health infrastructure?
That's what we have to watch for.
And what about our ability to respond to the next pandemic or other major health crisis?
Yeah. Are we going to be ready?
This whole thing is like a giant experiment.
It is.
And we're all part of it.
Yeah, whether we like it or not.
So it's really important to pay attention to what's happening and to hold our leaders accountable.
Absolutely, because the stakes are really high.
All right, that's all the time we have for today.
Okay.
Thank you so much for listening.
Thanks for having me.
And we'll keep you updated on this as it develops.
Stay tuned.